Welcome back to our special campaign, Vaccinate India, in partnership with Google. We're discussing questions you may have about the COVID-19 vaccine. We take to Google so many times to seek answers to these questions. Today, we have an expert doctor to take on these questions. Dr. Sandeep Dewan, Director Critical Care, Fortis Memorial Research Institute, is with us. Thanks, Dr. Dewan, for being with us on NDTV. I want to begin by asking you about the effectiveness of the COVID-19 vaccine. This is a recurring question given the fact that there are new variants of COVID-19 that emerge. There is discussion around dosing gaps of the vaccine. So how effective is it?
Good morning, everybody, and thanks for bringing me on the show. See, why do we vaccinate ourselves? You understand, we vaccinate for two reasons. We want to avoid the disease, and second, we also want to limit the severity of the disease. Okay? Now, if you look at the COVID vaccines, and all of them are available wherever they are in the market, in India or outside, the first aim, which is to avoid the disease from infecting the people, efficacy ranges between 60 to 80%. And if you compare it with other vaccines, whether the H1N1 vaccine, which we have been taking for the last 10 years, or flu shot that people take every year, the efficacy is same to about 60 to 80%. So we are looking at a very good efficacy rate of the vaccine, point number one. Second, even if you have a 30 to 40% chance of getting infected in spite of vaccine, there's a very high likelihood that the symptoms will be limited to mild. And please understand, only severe patients will die. Mild to moderate cases either are treated at home or require some sort of mild hospitalization. So we are getting both benefits with the vaccine. One, obviously the efficacy and decreased transmission. And second, limiting the symptoms to mild, which is actually a very, very important part of the vaccination program.
You know, speaking of vaccine efficacy, vaccine effectiveness, I think the people who have more number of questions are those with a history of an ailment or an illness, or those individuals who are considered immunocompromised. How effective is the COVID-19 vaccine in immunocompromised individuals?
So, in fact, we recommend that immunocompromised patients should take, because a disease which may be mild for you and me will come as a severe disease for a patient who is immunocompromised. Because see, they are immunocompromised because their body does not have the adequate antibodies to fight the illness.
Right.
So these kind of patients, in fact, would be more benefited with the vaccine. And they should in fact take these things hands on, because they are anyways at higher risk, and even if the disease infects them, it will actually come in a very bad way. So immunocompromised patients should go for it.
Right. I think the other important question that a lot of people, often take to Google to find answers to is self-care during COVID. If you're infected with COVID, you have mild infection and you're recovering and recuperating at home, what is the rule book? What are some of the do's and don'ts?
See, the do's are obviously you take what we call as COVID behavior, and the COVID behavior, which is called as COVID appropriate behavior, has to be applied both to the family members and to the patient. That's the point number one. You obviously self-isolate yourself in a room, and your daily activities, whatever they are, you are bound in that room for that particular period of time. Most important, please be under the instruction of a doctor. I'll tell you why. The rest, all data is available in the public domain, but our clinical experience this year has shown that this time the virus is far, far different from what we had seen last year in India. Last year, after 14 days, we were able to give a clean check to the patients. At this point of time, in spite of becoming corona negative, a lot of patients are coming back with recurrence of symptoms. Although we investigate them, they're still negative, but the symptoms persist. Odd fever, odd rise in platelets, some odd lab investigations are not, some breathing difficulty. So this time the illness is actually prolonging the recovery time much more than the previous year. So my strongest advice would be that once you're corona negative, please don't leave your medical doctor. Be under their supervision, because they know what things can go wrong. And the data now clearly shows in the medical literature that it can take as long as 3 to 6 months for respiratory and heart issues to resolve.
Right.
So that's why it's very, very important.
So even if you are in home care, it's important to be under medical supervision. So you have to consult your doctor. And I think the other very important advice that a lot of doctors have given here on the show, of course, is that do not self-medicate. Thank you so much, doctor, for sparing your time and being with us.
Thank you very much. Thank you.